spinous push. So how would you set up for that? Patient's going to be prone.
Unilateral.
Right, it's unilateral because it's hypothenar. Well, not because of it is. It's unilateral and it's going to be a hypothenar contact. And the contact's going to be on this spinous process.
What page is it?
And your segmental, or your vertebral segment is going to be T7-8. So how would you set up for this then? So you're in extension, the patient is in, T7 is in an extension malposition. So it's like rocked back like this. So how are you going to contact on their spinous process with your hypothenar in order to correct that?
We're gonna go from inferior to superior.
That's it. So the patient is going to be lying down.
Yeah.
You're going to, palpate. You're
You
going
can
to find
record it.
T7. So right at the bottom of the angles of the scapula, follow it across the T7. That's your T7 spinous process. You're going to put in your hypothenar contact like this here, and then you're going to put your other hand as a support hand on top of this, like this. And because it's an extension malposition, you want to get a lot of I to S, right? Because that means that the vertebrae has gone back like this. So in order to get it back, you got to get a lot of inferior to superior line of drive to bring it back here. So we're going to contact on the spinous process. This is your support hand, and then you're going to drive I to S. Okay. And you can do it on either side, whatever side you feel comfortable with for this particular move.
What does E mean? Oh, extension.
Which one?
E in parentheses.
Either, or either hand.
Oh, hypothenar, either hand.
Yeah,
Okay, got
either
it.
hand,
Okay.
depending on what side you're on.
Sorry, I'm just trying to make sense of the short.
Yeah, my little codes.
No, it's all good.
Do you want to do one on somebody so
Yeah.
I could do it for the video?
Sure.
Thanks.
Who wants to be a patient?
I'll do it. I don't care.
Thank you.
You wanna?
Hey, make sure this paper is clean. Okay, if you guys are working at a station, make sure that the paper's been changed. Also, too, I wouldn't, with things the way they are now, I would wipe off the headpiece and then put the paper back. So let's clean off this headpiece. Grab a spray and a paper towel. Don't go, even in your office, even before COVID and all that stuff, you want to maintain a nice, clean office. The worst thing a patient does when they come to your office and they look down and they see hair on here, grease on the headpiece, hair down in the crack there, that's going to reduce the the visuals are important in your practice. If you want referrals, then these are the things you got to be aware of. So, do we clean this?
Yes.
Yeah, that kind of stuff you don't care. Animal hairs don't matter. There you go. All right, go ahead and hit that one off. Okay, then we'll have the patient go face down. Set it up your table accordingly. So at your knee level. I'm not really worried about it right now. So this is an extension malposition at T7. Patient's prone. It's going to be a unilateral hypothenar contact on the spinous process. So you palpate down, find the rib angle or the scapular angles here. Come across T7. Then I do a little bit of a tissue pull for this one. Just kind of go like this and angle up underneath that spinous process like that. And to give a little bit of help with that. And remember, get the proximal portion of the hypothenar close to your pisiform. Because if you go too far distal, again, you're going to put a lot of strain on your wrist. Over time, you could develop a lot of problems from that. So here, and then I always kind of use my thumb and hook my wrist here. And I have my modified Fencer stance. And since this is an extension malposition, the vertebrae has extended back like this, I want to get a lot of I to S drive. So just like this. Then I'd have them take a deep breath in. And then they exhale, I follow them down. All the way, no, I can't do it. And then right when I can't go any farther, you know, boom.
Did that move?
You did it.
So you don't even have to like do anything. If you're in the right position and the patient is relaxed, a lot of times the vertebrae will just want to go in themselves. But you know, that's not as gratifying to the patient. You know, just to kind of like you know, just to have it fall in like that. So it's nice to really set it in there, and that feels really good for the patients. And again, be fast with your manipulation because then there won't cause pain. If you're slow with your adjusting, that creates pain. Okay, so everybody sit up, doctor, patient, and then switch.